Good afternoon. Welcome to Skyscape's webinar, How to Thrive, Not Merely Survive as a Nursing Student. I'm your host, Kristen Snowden-Smith from Skyscape. Our speaker today is Keith Rischer. Keith has been a practicing nurse for 31 years and is certified in ICU and ED. He is a blogger, and you can read his blog at keithrn.com. He is also a nurse educator and the author of Think Like a Nurse, Practical Preparation for Professional Practice, which he wrote to help students transition successfully to real-world practice. This webinar is being recorded and will be available later this week. We will have a question and answer at the end. Please type any questions you may have during the presentation in the window and we will get to as many as possible. Any that we do not get to, we will respond to via email. I will now hand the floor over to Keith.
Thank you so much, Kristen. It's a pleasure to present this information. And I want to thank each of you who are listening in and attending this live webinar. It's going to be relevant, and we're going to have fun and really engage with what is most important to help each of you be successful as prospective nursing students. We're going to have 4 essential topics for today's agenda. First part, we're going to talk about what are the essential character traits that are needed to be successful as a professional nurse. And we're going to use 10 reflective questions that I want you to kind of think about as we go through this information together and really say yay or nay, is that me or is it not? Secondly, what content from nursing school must be known deeply to be successful? Many of you have TMI in your programs. There's so much you need to learn, but really what is the most important? And we'll talk about that. Third, how to thrive in nursing school, how to really not just survive the experience, but to really make the most of it and to really come out better as a result. We'll also talk about some of the resources that Skyscape has to help you and to partner with you in being successful, as well as Q&A. So if you have questions, I want you to hold on to them and you will have an opportunity to answer them, or I will answer them at the end of this presentation. So as we look at nursing, I want you to know that if you're a student thinking about or are currently in a program, you are needed. Actually, the statistics show that nursing, whether it be LPN or RN, are a top occupation for growth for the next several years, with 1 million additional nurses needed. And this, I want to give you a vision for just the variety of positions. You know, with the 1 million, there's staff nurses that are the bread and butter of the profession, but also I want you to consider the advanced practice positions of being a nurse practitioner or a nurse anesthetist, as well as a nurse educator, are all areas of demand and practice that are also needed within the scope of nursing practice. So as we look at, do you got what it takes to be a nurse? We're going to look at 10 reflective questions, and I really want you to honestly be honest and to really see if you have what it takes. So we're going to look through these 10 questions. I'm just going to briefly highlight them here with the top 10. Number 1, what is your passion in life? Secondly, why do you want to be a nurse? Third, do you easily identify with the feelings of others? 4, do you enjoy and find fulfillment in serving others? 5th, is spirituality important to you? And how comfortable are you discussing this with others? 6, what kind of character do you possess? Not are you a character, but what kind of character? 7, do you possess a strong work ethic? 8, what are you willing to give up to make school a priority? 9, how well do you perform under stress? And 10, how well do you handle conflict with others? So let's jump in and look at our first question. Number 1, what is your passion in life? In other words, to look at your passion, ask this question: what would you be willing to do for free because you enjoy doing it so much? And I believe that each of us have a God-given passion that are just part of who we are, and our passions are in essence those things that we can do to make a difference in this world that are just part of our being. And for myself, about 10, 12 years ago, I realized how much I love to mentor and teach new nurses coming into practice. And I had an opportunity to, at that same time, to basically get my nurse anesthetist and make that a desire. But I basically was struggling because I've shadowed a nurse anesthetist and it did not drive me. It was like, yes, I can make good money, but at what cost? And I was reading this book that you see on the screen, Wild at Heart, by Christian author John Eldredge, and he had this quote that jumped off the page for me, and it's relevant for each of you. And he said this: don't ask yourself what the world needs. Ask yourself what makes you come alive and do that. Because what the world needs are people who have come fully alive. And so my desire for you is that, does this, what makes you come alive? And as I look at, for myself, it gave me permission to pursue my passion. And instead of being a nurse anesthetist, I became a nurse educator as well as a nurse in practice. And so when you look at your passions, what makes you come alive? Is it the opportunity to care for others or having a well-paying job with benefits? But if serving and caring for others is an internal passion, this is an excellent barometer that you are clearly on the right path to become a nurse. Secondly, why do you want to be a nurse? This is important because it digs in and looks at your motivation. And dig deep and look within. You know what the expected and right answer is if you've been asked it, because I want to care for others and serve others. But is it really true for you? What really gets you excited about nursing? Is it the ability to care for others or making good money in a job that is recession-proof, portable, and with numerous opportunities for overtime? If this is your primary motivation to consider nursing, I want you to carefully examine your choice to become a nurse, because studies have shown that it's that caring, patient-centered engagement of the nurse that has a direct correlation to patient safety and better patient outcomes. In other words, when the nurse is focused on what they get out of nursing rather than the patient care is secondary, patient safety is impacted, and adverse outcomes, including death, are more likely by the nurse who has this motivation. Question number 3. Do you easily identify with the feelings of others? This gets to the essence of caring and compassion. How you honestly answer this question is one of the strongest predicators if nursing is truly a good fit for you or not. Remember several years ago the old Gatorade commercials with Michael Jordan? Images of athletes sweating Gatorade correlated with the commercial message, is it in you? Do you identify and feel the pain and difficulties of others? Or are you aloof and indifferent? This is the essence of empathetic caring, when you can feel that pain and their experience. And a story that highlights this truth was the story of the Good Samaritan, told by Jesus over 2,000 years ago, when some Jews asked him, "Who is my neighbor?" And Jesus shared a brief story of a man who was severely beaten and left for dead and was lying on the side of the road. Now, 2 other religious leaders saw the man but ignored his plight. But the Samaritan, who was despised by the Jews at that time, when he saw the man, was moved with compassion and dressed his wounds and cared for him. And then Jesus asked a question: who of these 3 do you think proved to be a neighbor to this man? And they asked and answered correctly, the one who showed him mercy. And then Christ said, go and do likewise. And why this is important is that influential nurse educator and scholar of our generation, Patricia Benner, who was the author of the novice to expert theory that some of you may be familiar with over 30 years ago, she said this, and we need to listen carefully. She said, as nurses, we have been given the ministry and tradition of compassionately caring for strangers, of loving our neighbors as ourselves. We do not have to have great willpower to do this, or even great determination and motivation. But we need knowledge and skilled know-how, and we need to be open to see every patient as an opportunity to demonstrate this compassion to those we do not yet know. To see your patients as your neighbor is the essence of compassionate nursing practice. Question number 4. Do you enjoy and find fulfillment in serving others? Now, though nursing is different than working in a service industry that many of you maybe currently or have worked in the past, in food service or others that depend on tips, the very same principles of serving and making the patient or the customer the center of everything that you do and anticipating needs all translate to the essence of what it means to be a highly engaged nurse in practice. Though being a certified nursing assistant is a valuable experience, if you have not had this background, but instead were a waiter or waitress or other service industry jobs, those principles that you learned from serving others will benefit and prepare you as a nurse. Because the essence of nursing is caring and serving others in a time of need, that the patient and their experience matter to you. It involves doing whatever is needed to ensure that their needs are fully met. And so when you serve with that heart, you will be a nurse who will make a difference. Number 5, is spirituality important to you? And how comfortable are you discussing this with others? And some of you are probably asking, why does this matter? Why does religion and spirituality matter as it relates to being a nurse? Well, it's very important, and I'll tell you why. The medical model emphasizes the physical body. For example, if I need to have my appendix out, I don't want a caring surgeon. I want an excellent, skilled, technical surgeon, and his personality is secondary. In the same way, nursing care, though, is holistic care. And as you know, every human being has 3 compartments. We're not just a physical body, but we have an emotional as well as spiritual component to our being. And therefore, because nursing is unique from medical practice, we provide holistic care. Physicians as a whole do not. Therefore, we need to be sensitive to care for all 3 of these aspects of being. And if a nursing student does not recognize the importance of spirituality in their own life, they'll be ill-equipped to provide spiritual care with their patients who are depending upon you to go there. But let's talk a little bit about spirituality versus religion. Religion is a set of specific beliefs, texts, and other practices that a community or individual shares in its pursuit of a relationship with God or that which is transcendent. But spirituality is much broader than religion. It represents the individual pursuit and search for meaning and purpose in life that all of us ask. Why am I here? What is my purpose? Why did God allow that to happen? Are questions that each of us have at one time asked. But because the essence of spiritual care is hope and meaning. Hope and meaning are central to spirituality. And therefore, it is our goal as nurses to help our patients find meaning out of their experience as well as provide hope in the context of this reality. Because what's going to happen in practice, you're going to care for patients in crisis because of life-altering medical conditions that they've been diagnosed with or are currently experiencing. For example, cancer, chemotherapy, and radiation, and dying are all things that you will address. And therefore, providing that hope and meaning and being willing to go there is going to provide that holistic care that will make you the nurse that those patients and their family will never forget because you made a difference, because you were willing to go there. Number 6, what kind of character do you possess? According to the current Gallup poll, nurses continue to have the highest level of honesty and public trust. In fact, 80% of all professions. And no surprise, used car salesmen were dead last. But nurses also outdistanced physicians and pharmacists at 65%. So we must guard and value this public trust. Nursing is largely done behind closed doors or a curtain. And we need to have nurses who are motivated to uphold the public trust and confidence by living out the values that the nursing profession embodies. And I've just chosen a handful here for this presentation, but let's talk about these aspects of being truthful and honest, obedient, humble, sympathetic, and punctual. And many of you will say, I have all that. Well, let me ask a couple questions of each of these components, and I want you to honestly, again, reflect and see if this is truly in you. First, with truthfulness and honesty? Do you consistently tell the truth regardless of the consequences or only when it's convenient? Are you willing to compromise and cheat on an exam to get a passing grade? With obedience, do you find it easy to follow the directions of those in authority over you? With humility, do you readily recognize your limitations as a student learner? And are you comfortable asking questions to validate your knowledge base? Sympathy. Are you able to identify easily with the pain and suffering of others, or are you distant and aloof? And with punctuality, are you on time for class and clinical learnings? How about your current job or appointments? Number 7, do you possess a strong work ethic? As you know, nursing school is hard work, and nursing is even harder because we have the essence of patient acuity, especially in acute care and transitional care. The acuities have gone up significantly in the last 10 years, as well as the assignments and having multiple patients. And so therefore, being willing and able to work hard is foundational to nursing practice. Now, a nurse educator at the beginning of the modern era over 100 years ago, Isabel Hampton Robb, wrote in her text for nursing students titled Nursing Ethics, this little pearl. And this is what Hampton Robb said over 115 years ago. A pupil or student nurse should esteem it a piece of good fortune to be put on duty in the heavy wards, where one is always busy, where the work never seems to be done, and where there is so much in the way of nursing going on. Never be afraid to work hard and to work. Work pure and simple is not likely to do you harm. Never seek for the soft spots or the easy places in hospital work. Now, how did you respond to that insight from Hampton Robb? If you said to yourself, bring it on, you can be assured that you are on the right track to become a professional nurse. And ironically, little has changed in the world of nursing more than 100 years later. Number 8, what are you willing to give up to make school a priority? This is huge. Every one of us has 168 weeks or 168 hours in each week, no more and no less. And nursing is difficult and a very challenging major that requires at least 20 hours of a week time to study. So therefore, if you're really not, your goal is not just to survive, but is to maximize your learning to be the best nurse possible. So if you want not to only pass your program, but deeply understand what is being taught so you can apply it and critically think to the bedside, something has to give. Now, one area I would encourage you to look at is that you can control quite easily is social media and your social life. Have you ever counted the minutes and hours you spend on Facebook, Twittering, or YouTube, or other avenues of social media? I'd encourage you to take a log, make a log for a couple of days or a week, and see how much time you truly spend. Could this time be better spent studying? What about friendships in your social life? This too may be unrealistic to maintain the same level of engagement that you had before you were in nursing school. I have a question for you. Are you willing to make needed short-term sacrifice for long-term gains? This is the mindset that will help you be successful while in nursing school. If you are willing to do what is needed to make nursing school a priority, you will not only make it through the program, but more importantly, you will be the best possible nurse. But a final area that I need to talk about is the hours of work that you choose to work each week. Now, there are some students who must work in excess of 30 hours a week to support their family or have other obligations. I totally understand. But if possible, work less than 30 hours a week, while no more than 20 hours should be your goal. And this observation is based on students that I have taught who realized too late that their decision to work more than 20 hours a week and be a full-time student was too much, and they ended up failing or dropping out before the end of the semester. Now, I can hear some of you crying out, I am the exception. I've been to school before. I've handled this load before. That may be true, but there is one small but significant difference. You did not go through nursing school before. Number 9, how well do you perform under stress? Now, in addition to being hard work, nursing school and clinical practice is inherently stressful. Again, with multiple patient assignments, juggling many balls, and the stress of practice can be quite stressful, as well as the dynamics of life and death. Now, the image here on the screen is, I serve and have served in Haiti with medical mission. It's a passion of mine, and serving the poor in the developing world. And in the context of being in Port-au-Prince a few years ago, just after the earthquake, cholera was endemic. And we had a community clinic in Port-au-Prince. And this elderly woman, 6 hours earlier, contracted most likely cholera with profound vomiting and diarrhea. And she passed out in the middle of the street just across from the church that we were having clinic. She was carried in. She was pale, or not pale, but she was ice cold, sweating, and had a blood pressure of 60/30. She was in severe shock and was dying. We had 2 IVs. I missed the first. It's very hard to with a woman who's in shock to access an IV, but by the grace of God, got the second IV in. I functioned well under stress, and my ER experience certainly helped me in that. We got the IV established, got her fluid resuscitated, and I heard later that she did survive. And so that type of stress is going to happen. And for some of you is this. You have all been trained, if you're a student, in basic life support is a required prerequisite. But being trained to do CPR is one thing in the classroom. But what about if you come upon your patient who is not breathing, has no pulse, and now requires CPR? How will you handle that stress? And so recognize that this requires experience, so I don't want you to feel overwhelmed, like, oh, I'd be totally freaked out. Yes, you will, but will you stay steady? Will you stay clear with your mind and your thinking? That's the greater question that I really want you to consider and to go there. Number 10. How do you handle conflict with others? This is another huge predicator of nursing student success, because when you look at this question, it will help you look at being, are you going to be part of the problem or part of the solution to bullying and incivility in the nursing profession? If you have conflict and you disagree with another person, how do you handle it? Do you still value and respect their perspective and seek to find common ground? Or are you able to step back and view this conflict from their perspective and the stress that may have influenced and not make unfair assumptions? Or do you personalize this conflict as an attack on yourself and think negatively of this person and share your critical concerns with others? Though this type of behavior may appear to be normal, in some circles it is unprofessional and must be called out for what it really is. Bullying and disrespectful behavior that can deeply wound and destroy another person. And so one of the challenges that I saw with my students that is way too common and almost like part of the student culture is that you talk ill and negatively of other faculty, this nursing program, and even other students. That's uncivil and unprofessional and bullying behavior, and that needs to stop. Make a commitment to not to speak negatively of others. If you have an issue, go to the person directly and commit to value and respect your colleagues, your faculty, and patients always. So how do you do with my quiz? As I said, I want you to reflect on this gently. This is totally unscientific, but if I use the same bar of nursing school success of 78 to 80%, if you got 8 to 10, that's me, consider that nursing is likely a good fit and you have the aptitude to be successful as a nurse in practice. If you scored 5 to 7, you're a work in progress. But my goal with this is not to say, oh, even if you had less than 5, oh, get out of nursing school, you shouldn't even be there. No, no, no. What I want to say is this. Recognize that these components of practice are foundational and essential to nursing. And if you're struggling or maybe this doesn't totally fit you, you can change and make your weaknesses that you've currently identified a needed strength. And so as you work through the program in the weeks and months and even years ahead, make it your goal to have each one of your weaknesses on your radar so you can be successful and a highly engaged nurse in practice. So now let's look at the second part of our program. how to thrive and not merely survive as a nursing student. And we're going to start out with the first slide, looking at what type of degree should I pursue. And this content is really more to kind of give you a big picture of nursing as well as for prospective nursing students. When you look at the nursing track, there's really, I think, there's two primarily tracks of the LPN, which is the licensed practical or vocational nurse, primarily a 12-month degree. Now, they typically are not going to work in acute care, but are going to work in skilled or long-term care settings, transitional care, and home care. But the good news about an LPN is that you can start there and then transfer into the second year of a community college RN program if that is a better fit. And for some students, this is an excellent way to just transition gently into nursing because the scope of practice is different. Similar but different, and I'm not going to take the time to go into that, but you can do the research on that content. The registered nurse has basically two different tracks that are most common in practice. First is the associate degree, which is primarily a 2-year degree that really is 3 years. That's the hitch because you have to take a year literally to do the prerequisites and then the 2-year program. The baccalaureate degree is a 4-year degree, and I want you to know that the baccalaureate is becoming the entry-level standard slowly and surely in the United States. Where I work here in Minneapolis, with a large healthcare corporation, they will not even look at you as an applicant with a 2-year RN. You must have a baccalaureate. Also consider the master's degree. You have a 6-year level once you've had your baccalaureate. For 2 years, you can then get your nurse practitioner and be an autonomous practitioner in a multitude of specialties, or a nurse anesthetist and pass anesthesia under the direction of an anesthesiologist. But this is key. This is if there's one thing that I'd like every one of you to do if you're currently a student is this: lower your expectations. Now, unrealistic or high expectations for relationships and in life will produce nothing but stress and heartache. The same is true for nursing school. Because I've observed that nursing students as a whole, I love working with them, but they are driven, they're perfectionistic, and they're used to getting A's in high school or college. They are high achievers. But in order to successfully transition to nursing school, you must remind yourself that you are no longer in high school or a less difficult major in college. You're in nursing education, and again, one of the more challenging and difficult majors. So if you're an A student, you may struggle to maintain this grade. So again, lower that expectation and be satisfied with a B or even less. And accept this reality as your new normal. It's not your grade. It's your learning that you're doing. And even though you may have issues with the test questions and all of that to get that percentage up to an A, let it go. Are you learning? Are you growing? Are you developing the skills to be a nurse? That's what matters. So continue to learn and apply yourself to be the best. This is what matters. So take a deep breath and remind yourself this, that your letter grade does not define your value and worth as a person or a student, nor is it a predicator of whether you'll be successful as a nurse in practice. And then this aspect, take care of yourself. You're going to feel like that gerbil wheel. Any of you have gerbils when you were kids? They get on that wheel and they just run, and they do it from dawn till dusk. Many of you will feel just like the gerbil. Though being in school will consume you with new challenges and additional learning, do not let nursing education become your life. Fight to overcome the tyranny of the urgent, which is really the tendency to allow your life to be dictated by the urgent things in life, including school, but then neglecting what is most important, like your faith, your family, and your relationships around you, simply because they do not demand your immediate attention. You must also remind yourself of the need for personal renewal of your body, mind, and spirit, because if your tank of renewal is empty or dangerously low, if you're continually in high stress mode, this will directly impact your ability to be fully engaged in caring in practice. And so take care of yourself with the obvious personal lifestyle strategies of getting enough sleep, eating right, taking breaks, embracing margin, and taking those time out, as well as educational strategies I would say is you need the support of others. Some of you are more prone to just be lone rangers, the American spirit. I can do it on my own. I'll get through it. No, you need the support of others. And this principle was validated over 2,500 years ago by Solomon, the wisest man who lived, who wrote in Ecclesiastes in the Old Testament, 2 are better than 1. For if they fall, the one will lift up his fellow, but woe to him that is alone when he falls, for he does not have another to help him up. And you need fellow students to support and lift you up in practice. Now, what you must know, let's talk briefly about what are some of the key aspects that must be known deeply that will translate to your success as a nurse in practice. First, anatomy and physiology. You've got to embrace the sciences and recognize the value of anatomy and physiology to practice. Now, most of you have had physiology as a required prerequisite for nursing, and you've thought that once you completed this difficult prereq, you were done, you survived, and could now look forward to nursing. But this is wishful thinking. In order to deeply understand the mechanism of action of medications that you give, accurately interpret lab values, and understand the disease processes of every patient you care for, anatomy and physiology must be deeply understood to critically think and apply this content to the bedside. For example, one of the most common complications seen today in acute care is sepsis. Understanding the complexities of the inflammatory and immune response are foundational when caring for a patient with sepsis. Heart failure is another example of knowing the differences between right and left and why it matters. Also, the ability to understand the mechanism of action of your drugs. For example, if I were to ask you what is a beta blocker blocking, like atenolol, would you know and put in your own words what a beta blocker is blocking? That knowledge base is what you must have to situate your knowledge to the bedside and not just memorize it or parrot it out of a drug book. What else you must know well is pharmacology. I love this slide. Keep calm and study pharm. That's a good quote and a good standard to live by in nursing education, because you're going to administer medications every day. And you must therefore possess a deep understanding of pharmacology and able to state in your own words the mechanism of action of a beta blocker. What is a beta blocker blocking? What is a calcium channel blocker blocking, like cardizem? And what is an ACE inhibitor inhibiting, like lisinopril? Why is that important? Well, when the mechanism of action is deeply known and not just memorized, you will be able to put 2 and 2 together and recognize what are the nursing assessments that I need to either do before I give the medication or then follow afterwards, knowing how it will impact the body physiologically. So for those of you out there with an ACE inhibitor, do you understand deeply the importance of the kidneys and renin, and then the secretion of angiotensin 1 and blocking the conversion of angiotensin 2, that causes vasodilation but does not affect the heart rate. Therefore, the assessment that is needed is not the heart rate, but is the blood pressure alone. Finally, fluids and electrolytes are essential to know deeply and looking at this in an applied way. I don't want you just to have memorized the hypos and the hypers of sodium, potassium, chloride, calcium, and magnesium. That will not benefit you. What you need to be able to do is have a deep understanding of this content to apply it to patients who have early physiologic status changes where lab values and the acid base and the chemistry components of this content is deeply understood. So for example, you're going to have trends of a patient who is, for example, in shock, septic shock, who has now an elevated serum lactate, elevated creatinine, elevated potassium, all as a result of the same problem of a lack of perfusion. Do you understand these concepts well enough to understand why a low perfusion to the kidneys is going to elevate the creatinine, elevate potassium, and then cause an elevation in lactate? That's the level of understanding that you want to pursue as a nurse in practice. And now I want to just briefly talk about beyond graduation. There are some of you here who are on the threshold of graduation or are already there. I just want to share several things that I've seen and observed in my own practice that I'd like to share with you as well. Number one, get a mentor. Every one of you need a Yoda, a guide who will help you as you look at what it takes and the struggles that you're experiencing, that you can look at to model and to be a one who imprints by their example what you want to be. Look for that be like Mike type of nurse. Secondly, ask questions. You must never fake it as a nurse. And you're going to be tempted sometimes to be like that dude who just doesn't want to ask questions for directions. Don't do it. The stakes are too high because patient care and outcomes can be impacted when you do not ask a relevant and important question. So never fake it. And you could have, again, ask and humble yourself. That's why humility is so important to practice, as we talked about earlier. Number 3, be humble. You don't know it all. Although you are a new nurse, some students have kind of a little arrogance that they know it all. You're not that nurse. Be humble. 4th, show respect to your colleagues that are now in practice with their experience. Respect the knowledge and experience. Even if your personalities don't mesh, which is going to happen, respect their knowledge and what you can learn from them. 5th, network with other nurses and find a solid support system. Again, the principle of collaboration. You need each other. Therefore, find others that you can look to for needed support in the practice setting. You must also be a lifelong learner. Just because you are now in school or graduate, you are never done learning. Be a lifelong learner. Things are continually changing in nursing and in healthcare treatments. You must stay on top of it and embrace the role of being a lifelong learner. And finally, keep your nursing books. Some of you are tempted, thank the Lord, I am done, and I'm going to make some money off my texts. Do not be that nurse, being students. Keep your nursing textbooks, especially the foundational ones of Med Surg, Pharm, and that are foundational to practice, because you will refer to them and you will need that content as well as relevant information on the web. So that's our content. I'd like to turn the floor over to Kristen, and she will share how Skyscape and their resources can also help benefit you as a student nurse.
Thanks, Keith. Skyscape, if you're not aware, is a mobile app that we have, and it will provide you answers when you need them anywhere you are. So if you have a smartphone or a tablet, you can use Skyscape on those devices. Next slide, please. So, as I stated, it's an innovative learning tool. It allows you to put your nursing textbooks on your mobile device so you don't have 12 pounds of books in your backpack wearing you down. You'll always have it with you. We have over 1 million users using it. There's over 400 medical resources to choose from. 100 of them are nursing, and they're from 30 different publishers, and they're integrated into one app so you can cross-reference from one book from your publisher that's Elsevier to another publisher that's Lippincott to F.A. Davis. Next slide, please. So the top reason to adopt mobile technology is that most HCPs, 71%, consider smartphones an essential part of their practice, and 84% consider it critical. It's portable and it's available at the point of care. You'll have up-to-date information, and it creates a digital library so that you can continue to use this as a healthcare provider. And that's one thing that Keith said, is keep your resources. You'd be able to keep your Skyscape resources with you on the device that you have. It's also nice to have, you don't have to worry about losing your books in the clinical site or forgetting them too. Next slide, please. As I stated, the Skyscape app is available in the Google Play Store, the App Store, and we have select resources that are also available online through our WebView tool. You search Skyscape Medical Library and you can download the free app, which comes with a clinical resource, a drug guide, and a medical calculator for free. Next. So, in addition to the free resources, we will be giving you a free complimentary resource that Keith wrote, Do You Have What It Takes to Be a Nurse, just for attending or registering? And there's some additional information in here you can review and reflect on. You could also purchase any of your resources that you need for nursing school. We have a portfolio of over 100 resources integrated into the app, which are all have the ability to cross-reference. So you want to have access to credible information, so you want to have your drug guide. 71% of nursing professionals use a smartphone on their job, 66% of nurses use a smartphone in nursing school, and 85% of nursing respondents have a drug guide on there or want a drug guide on their smartphone. It's also nice to have an app version if you have something in print as well. And this is from a survey done by well-known publisher Lippincott, Williams & Wilkins. Next slide, please. So, Skyscape offers the 100+ nursing titles from fundamentals to NCLEX. So we have everything from your Taylor's, Donges, Nurse's Pocket Guide to Diagnosis, RN Notes, and much more. We have your dictionaries, whether you need Stedman's, Dorland's, Tabor's, or maybe you need an English and Spanish word phrase conversion book. We have that too. We have Davis Drug Guide, we have a Lippincott Drug Guide, we have Mosby's Drug Guide, we have IV medications. We have many med-surg and lab and diagnostic test books from Fischbach to Pagana and Mosby lab and test references. Once you graduate or you decide to go on to an advanced degree, we also have specific stuff for OB, psych, and pediatrics. And as you prepare to get your take the NCLEX test, we have some testing materials available as well. And we have evidence-based manuals and journal articles that you can read to keep abreast of the changing information in the medical world. Next. Skyscape, we realize as a nursing student that money is tight, and we've put together some value suites that have drug information, lab information, disease information, and calculators, and they're all in value bundles. You can purchase these at a great price where it averages out that books are less than $30 a piece, or you can build your own collection depending on what you need for your nursing school. Next. So Skyscape is more than an ebook. It has a lot of features. It has colorful images, interactive flowcharts. You can easily navigate through sections. We have a search which allows you to, called Smart Search, which allows you to search through the entire library, and I'll go into that a little bit more. We also have a Smart Link which allows you to cross-reference from one topic to another. So if you were to look up a disease and then look up a drug and you want to look up another drug, it's just quicker to do it in the device. So Smart Search, what you do for this is when you have your Skyscape app installed, you just search for the topic by tapping into the Smart Search field. And you can quickly, easily search the entire Skyscape library for that topic. Next. So in this case, if I were to type in pulmonary embolism and hit search, it would search my entire Skyscape library for pulmonary embolism, and it would come up with a result, and then I would be able to look at the results. Next slide. The results show what book it's in and what the actual topic is. If I tap on the topic, it would then bring up that information. Next. SmartLink is Skyscape's cross-referencing, so it automatically links the current topic with related information in other Skyscape books. So you look up your disease state, you then go and choose your drug guide, and then once you choose the drug guide, it will then pick the drug, and then you can find additional information that way. It's very fast, much faster than doing it in traditional text, so you have the information at your fingertips when you need it. Next. We also provide inline dosing calculators, so if you happen to be looking at a drug and you want to know the specific dosing for that, you can do that by going into the route dosage section. In this case, it's warfarin, and it's denoted by the little calculator icon, and you put in the patient's weight, and you can choose it from SI to conventional depending on what you want to look at, and then it'll give you the resulting dose, and all the calculators give the information about the calculator and how it's set up at the bottom. Next slide. Back
All
to
right,
you, Keith.
I'll just briefly share, I have a website that I created originally for nurse educators, keithrn.com, just my first name, RN, and you've got my website. But I currently have a lot of resources for students as well, and I've just written my second edition of my book, Think Like a Nurse, Practical Preparation for Professional Practice, that is really a unique student resource that has highlights and emphasizes what is most important to know with the content of nursing education. The things I discussed in this webinar, I go into deeper explanation. It's not a textbook, it's the untextbook that really just in a nice conversational manner, just like the webinar, will help guide and develop you as a student and break down the thinking. To think like a nurse using clinical reasoning is very complex, but and many programs don't emphasize this information in their curriculum. It's developing and it's becoming more popular and more current, but still, change takes long to develop in some programs. And so I talk about that and help develop your thinking, as well as just how to practically priority set and manage your time once in practice. And talking about that with tools and handouts that I've created for my students, I created and put in the book. And it also comes in both a paperback or ebook from my website, or Skyscape will be publishing this as part of their platform in the next 2 to 3 months. So that'll be available by the end of the year. I also have a free bundle of student resources on my homepage of KeithRN that has sepsis case studies that have this concept of clinical reasoning woven in, as well as a template of clinical reasoning to help you priority set for every patient you care for. These will be very helpful for you, and it's my gift to you, to any student who needs it. I also have a weekly blog, again, that you can access and sign up for, as well as a YouTube channel, Think Like a Nurse, just like the title of the book, with fun topics and outside-the-box thinking on nursing education and much content for students. And as well as my contact information is on my site, but there it is for you as well. If you want to email me, I'm very responsive to any student questions or comments, so please stay in touch. I'd love to hear from you, and anything that I can do to help you be successful is really what I'm all about, and it's a pleasure to serve in that context. So as we look at the webinar, final takeaways, what I really want you to kind of reflect is know yourself well, and to really reflect on nursing and really determine, is this a good fit for me? And again, I'm making no judgments that you're not based on how you responded to those questions, but I want you to develop those weaknesses and make them a strength, and make sure that nursing's a good fit for your personal passion, not just doing something out of duty, but you do it out of delight. And finally, utilize resources that will help you be successful. That's what I, with my resources that I've created, as well as Skyscape, utilize. There are people out there that really want to partner with you to facilitate your learning and to be the best nurse that you can possibly be.
So now we have some time for some questions. We have a couple of questions from the audience, Keith. We have one from a student who's first-year student, and I'm sure many can relate to being nervous about being a first-year student, and maybe they don't have a lot of medical background and stuff like that, but they have the heart for it. Do you have any recommendations for studying to get through these tough courses?
As far as, one of the problems in nursing education that is in the literature is that we give students too much information. We expect them to master the majority of content in the textbooks, and you can never really know it all. And, when you look at, in a perfect world, you want to insist that your educators, your faculty at your program tell you what content is really most important that I need to know deeply, and that's going to help you guide your studying. But some educators say everything's relevant, you need to know it all. Well, you can't know it all, and so my encouragement to you is that you need to have a target of what to study before to really master what's most important. And so if possible, if your faculty provide a study guide on the content that they are presenting, or if you personally inquire them and just share your heart and say, what really are the most important concepts or content? Because you need to have a target that you're shooting for, because you can't know it all. And so encourage your faculty to provide you with that knowledge and information so you can then know what to shoot for and hit the target. And so in a general way, that's the best response that I can give you. There's numerous studying tips and things that are out there on the website, and utilize those principles. But more importantly, in nursing school, use basically your faculty to help guide you to develop what is most salient and most important, and then you do your best to study that content and to know it well.
Okay, another question is, one student says, nursing school has been fairly easy for her, but she's afraid of not knowing what to study or passing the NCLEX exam.
Yes, and I want to emphasize that the NCLEX is important, but it's only a multiple choice test. And your goal as a student is not just to pass a test, but is to be well prepared for professional practice. And so really that was the underlying motivation that I wrote my book, Think Like a Nurse, Practical Preparation for Professional Practice, was from my lens of 30 years of clinical experience and several years as a nurse educator. I have a unique bifocal perspective to help students and new nurses really get what is most important and what principles do they need to know well to make that transition successful. And so my resource is unique, and I'm not here to plug my book, but I want you to know that it is a tool that will answer some of those very important and very good questions that you and other students have, so that you are well prepared and and able to be the best nurse that you can possibly be.
Thanks, Keith. Another question we have is, as a student, do you have any words of wisdom for returning to nursing school after failing one semester?
It depends on what were the contributory factors to your failure, but I think that we need to, we all make mistakes. And there's things in life that we, that we wish we would have done differently. And I guess I'd encourage you with two things. One, learn and reflect upon the reasons that you were not successful the first semester, and look at that very hard, really reflect deeply. Was it because I was working too much? Was I not making it a priority? Was I not studying effectively? Whatever it might be, identify those, reflect deeply to understand what it was that contributed to your lack of success. And then secondly, know that you've got a new beginning, and your past mistakes and your failures do not define you as a student or as a person. Therefore, let it go and embrace new day and a new beginning, and really try to hold loosely the past and try not to let that past failure in any way define you. We all have tapes in our head that remind us of the things that we wish we were or could have done differently. Silence those tapes and move forward, knowing that today is a new day and a new beginning.
Thank you. One more question we have kind of goes back to question number 3 about feelings. This attendee asks, is being indifferent with other people's feelings a weakness or a personality? And how can you improve with connecting with others, especially in nursing?
Boy, that's a great question. And part of that aspect needs to kind of be developed, and needs to, in a basic way, you do need to have a basic comportment that, use this lens of caring from the literature. Does the patient and their experience matter to you? What you want to be able to do is kind of put yourself in the patient's shoes and empathize. That's the essence of empathy. And some of us do that better than others, but I think we all have the capability as human beings to empathize. And I think for some it comes easier than others. If it doesn't come easy for you, really just be more intentional to say, wow, I'm taking care of a patient who has breast cancer and she just lost her breast to a mastectomy. She's only 40 years old. What would that feel like? What would that be like if you were you may even be the same age, and you can empathize much more readily when patients and their experience are close to you. But really think about that, and don't minimize it. Don't distance yourself. Don't disengage, but to really intentionalize and engage with your patient, and to really kind of use that lens of empathy and just keep that before you. And that's a really practical guide to help you to cultivate empathy. You can change. If it doesn't come natural, that's what I really want to encourage all of you who are listening into this webinar, is that, identify these weaknesses. That's awesome that you did that, and I commend you for that honest reflection. But now just know that there are things that you can do to kind of just re-engage, and just using that lens of just putting yourself in their shoes more intentionally and consistently can be a helpful guide to develop that needed empathy that's required for nursing practice.
Thank you. Another question. A student starting nursing school with no prior medical knowledge, it's common to be told to read NCLEX review texts and use NCLEX questions as a study guide. But what if you don't understand it? Should you keep plugging along, or is that something you actually try maybe in your second year or third year?
Yes, this is one of my hobby horses, and you're going to get me started, but nursing education is not about passing the NCLEX. It is a required speed bump. It is merely a multiple choice test. And yes, to be reviewing NCLEX questions in the first year or at any point besides the end or towards the end of the program, to me is just foolishness. You don't have the content knowledge to understand the priority setting for the NCLEX questions, because the NCLEX is assessing baseline level of competence for a graduate nurse. And it's kind of like expecting a kindergartner to do algebra. It's not going to happen. You start with 1 + 1. And you don't basically, in the same way the NCLEX is a very high level examination, and to be expecting students and encouraging them to review the NCLEX early in the program, to me, I don't see that as an effective strategy, because you don't have the knowledge base to be successful and understand unless you have two things: additional content knowledge as well as clinical experience that you've had throughout your clinical settings throughout the program. Those two things together are required to be successful for the NCLEX, and to begin to understand the essence of the priority setting and recognizing relevant data from the examination questions. So I truly would not encourage any student early in the program to even touch the NCLEX manual in those test questions. Leave them alone. Wait till you're in the final semester. Not that you have to just pile it on, but realize you don't have the knowledge and skill set to be successful and understand the NCLEX questions until you're towards the end of your program. I hope that helps.
Thank you, Keith. And another question. Someone who's just starting nursing school, do you have any recommendations on what they should brush up on, whether it's anatomy and physiology, medical terminology, general information? Any recommendations?
Yeah, and I think we addressed it in this webinar, and I think that those three aspects that I really touched upon, the importance of anatomy and physiology, and knowing the and understanding physiology so you can contextualize it. You see, it's one thing just to pass a program or to just get through A&P. It's another thing to understand it. And you want to make understanding your goal, not just passing a difficult prerequisite. So you want to make anatomy and physiology foundational knowledge to your practice. And so review that information from whether you took it or you're currently taking it. Make it a goal to understand these important physiologic principles that you're learning. It's hard content, but you can do it. Physiology, the importance of pharmacology, which is really applied physiology, because you're understanding the mechanism of action, which is applied anatomy and physiology. So those two go together. When you know A&P, you know pharm. Third, fluid and electrolytes. That understanding the application of fluid and electrolytes, not just again knowing the memorization of the hypos and the hypers, but understand F&E deeply. So you're able to apply it to the unique subsets, like a patient with sepsis, with acute renal failure is an excellent, and then the acid base and the electrolyte imbalances as a result of the acute renal failure. That's what the nurse needs to know. It's not about passing tests. It's not about memorizing content. It's about developing a deep knowledge of this content so you can apply it and critically think at the bedside. Nursing is a practice-based profession. It's not about passing tests. So my encouragement to you as students is not to have this mindset of memorizing, to just pass the test and get through the program. Make it a priority to develop the knowledge and understand the content so you can apply it to the bedside.
And final question here, Keith. Someone asked, have you actually used Skyscape?
Yes, in fact, I have, and that's why it's such a pleasure to present with Skyscape. If there is one resource that you need to have from Skyscape in their library, it is your drug manual. And Davis Drug is what our program used and what I have had on my smartphone for years, even as an experienced nurse, because this is what accessibility is all about. You will not bring a 1,500-page drug manual to your practice setting every day once you're in clinical. You're required to. I bet most of you will not do it when you are working in the acute care or whatever your practice setting may be. But having it accessible, you bring your smartphone with you. You bring your phone everywhere you go. That's the accessibility, because it's on your memory, not on the web. So these, like Davis Drug and Skyscape, the way that it's linked and the way that's so easy to access, if I have a new drug with Davis Drug on my smartphone, in literally 10 to 15 seconds, I know what a new drug is, what its classification is, what its mechanism of action is, what the safe dosage, and within 15 seconds, I'm safe to give. But if I have to go hunt down a paper manual and find it and then look it up, that takes 2 to 3 to 5 minutes. And when you're busy with multiple patient assignments, you don't have the time for that. And you may be unsafe if you don't take the time. But accessibility is key. And I can't encourage you enough that if you get one text from Skyscape for your smartphone, let it be a drug manual that your program is using, and ignore the paperback version. Buy the Skyscape electronic version, and you will take that information then not only through every clinical setting, but you'll have it with you when you have your first job, and you will continue to be safe and be that knowledgeable nurse in practice.
Thank you, Keith. Well, that's all we have time for questions today. We have a few more slides for you, and we'll be wrapping it up in just a few minutes. So we touched on Skyscape, and Skyscape has a galaxy of resources and tools available to you. The Skyscape Medical Library gives you access to textbook content from 30 publishers in one integrated app. And by getting this app, you do get a free drug guide, a clinical resource, and the medical calculator. So it's worth just going out and getting that for your smartphone. We also have a Skills Hub app. This is a mobile app to learn, track, and assess your nursing skills with step-by-step instruction, video tutorials, and related NCLEX type questions. So you can go ahead and get that app as well. We have an NCLEX question of the week, which offers NCLEX questions that are attempted by thousands of students weekly. It's also available to use by institutional groups. We have a NTRAC. It's a clinical log system which allows you to track your clinical experiences. And for fun, we have SnapWord. It's an app that's a human anatomy word game that includes over 100 beautiful images of organ systems, skeletal systems, and muscular systems, with more to come. I want to thank you for attending our webinar today. You will receive an email later this week with information on how to access the archive and get the complimentary resource, Do You Have What It Takes to Be a Nurse? To learn more about what Skyscape has to offer in our galaxy, you can go to skyscape.com/groups. To learn more about other webinars we have, you can go to skyscape.com/webinars2015. This is also where this webinar will be available on demand later this week. If you have questions, you can email webinar@skyscape.com, and you will get your complimentary resource as I mentioned. That's all we have for today. Have a great day. Thank you.
Thank you so much, and blessings to you as you pursue your passion to be a professional nurse.